Well, fluid management is important for the patient because if she starts absorbing fluid, it can be life-ending or at least dangerous to her health.
Fluid management would be very important due to the fact that excess fluid intake can cause a shift in body electrolytes. We're talking pulmonary edema, cardiac problems.
The three most challenging parts of using the system at present for those that do not use it on a regular basis is setup, it is changing of the deficit information, and then having an accurate deficit number.
My challenge day to day going into operating rooms, initially if we have a new piece of equipment, is knowing how to set it up.
To improve the current system that we use would be less setup steps. We have a canister system right now, which gets to be this one goes with this one goes with that.
When I first saw the Fluent system, the first thing I noticed was, wow, I could see the bag. I see the bag very clearly. I can see exactly how much is in it. It is very streamlined, fluid management system. Didn't have all those canisters hanging off of it. It just looked neater, more polished.
It's really like the Rolls-Royce model. It's going to make our jobs a lot easier as circulator nurses setting it up, as well as the scrub person. So what I like is the packaging. It comes with a disposable bag which holds a large volume. There's less pieces that you have to connect.
The nurse has the confidence to know that it is set up correctly and that they're going to get the accurate deficit volume that needs to be given to the surgeon doing that procedure, and it just allows a lower anxiety level for the nurse. That is something that the patient can perceive and be a little bit calmer.
You can touch on the part of the touchscreen that you have a question about. So if you have a question about where to hang the bag, you can touch on that and it tells you what to do.
The efficiencies of the Hologic Fluent system is really going to help us nurses feel a lot more comfortable with using a piece of equipment that they may not use frequently, because the whole knowledge base is integrated into the piece of equipment, and I think it's going to allow us to have a shorter preparation time so we can get that patient in much sooner, because it's so much easier to set up and use.
I think that Hologic took into consideration a system that has been overlooked. And coming from the Women's Hospital, it's important. We love our women.